right, welcome everybody to our training. This is the Psilocybin-Assisted Therapy Association and our training on how psychedelics can help individuals with terminal diagnosis. Presented by a good friend and colleague of mine, Christine Caldwell, who's the executive director and founder of the end-of-life psychedelic care. She has a lot of knowledge and a lot of background within palliative care and helping people with terminal diagnoses, as well as just addressing mental health, concerns for people, whether or not they're directly impacted, having it personally done to themselves, or within the community that are supporting these individuals. My name is Jason Burge. I'm the co-founder, along with Lisa Ritter, of the Psilocybin-Assisted Therapy Association. Our mission is to promote the advancement of psilocybin-assisted therapy to address the mental health crisis. EOLPC, the end-of-life psychedelic care, and PATA are both strategic partners. I'm the board chair of the organization, and Christine is on our advisory committee for PATA. So we have a strong alignment around just how we believe that psychedelics can help address individuals' mental health concerns, as well as training individuals on how to best take care of those people that are in there. And Christine will get a little bit more into that in her introductions. We are going to limit the use of the sidebar discussion, so we're going to ask that all questions be just hold on them until the end, so this way we can stay focused on the presenter. And then at the end, you can either ask questions in the mute or on the side, or you can ask them, you can raise hands and ask them directly. So I will turn it over to Chris now.
Care, so I'm quite pleased to have him. And I'm on his advisory committee, so I'm pretty jazzed about that too. But welcome. I just love that you're all here, and hopefully we'll have some fun today. I saw that a few of you don't know a lot about psychedelics. I sort of geared the presentation for those who are more familiar with it, but I will have a deal for you at the end where I give presentations periodically, and I'm doing one in September, a free webinar on an intro to psychedelics, where I dive more into the neuroscience. So today we're going to stay focused on psychedelics as it relates to end-of-life issues. So really for anybody with a life-threatening or terminal diagnosis. Okay, so let me go ahead and share. And as Jason said, if you could hold off on putting anything in the chat until the end, I would really, really, really appreciate that. I'm more than willing to stay over to make sure we answer your questions. So no issues there. So a little bit more about me. As Jason said, I am the founder and executive director of this nonprofit end-of-life psychedelic care, and I'll talk a little bit about that at the end. Just prior to that, I was working with a psilocybin retreat center in Jamaica, Diaspora Psychedelic Society, and they were one of the first organizations or retreats to develop programs specifically for end of life. I recently graduated from the 12-month Psychedelics Today Vital Training Program. I highly recommend it. Unless you're in Oregon, then you definitely need to do one of the Oregon licensed training programs. I am currently enrolled in Dr. Rosalind Watt's ACER integration program. For any of you that know her, she was instrumental in early on psilocybin research studies out of Imperial College, and has gone on to build her own integration program around accept, connect, embody, and restore. It's an excellent program as well. I'm certified through Deepak Chopra in health and meditation, and also a total well-being coach. And for several years, I owned a 250 client home healthcare agency, which I think really started me on this trajectory of caring for and caring about older adults. And it's kind of like once I started to study psychedelics about 3 years ago, I just seemed to gravitate towards wanting to help an older population faced with terminal diagnoses. So the mission of the nonprofit is to reduce the existential and psychological distress associated with the fear of dying. And I think for anybody on this call, I am sure that's true as well. But, you know, I think for all of us, we also would agree that not just removing the fear of dying, but also to start to look at this next place. And this is an excellent little book by Warren Hansen, who encourages us to look at the next place with awe and wonder and to look forward to it. So I think about that a lot in terms of how I think psychedelics can help do that for us, for our clients, for whomever we are working with. And of course, there's many ways to get to this next place. Meditation, breath work, through religious faith and prayer and all the above. But today, of course, we're going to talk about psychedelics. What was interesting to me is when I started to study first psilocybin, you know, psilocybin research as it related to cancer patients really had the best, well, let's say some of the best, if not the best outcomes in psilocybin studies. And we're going to talk a little bit about why, at least I think that is true. I mean, it clearly has to do with the neuroscience and neuroplasticity, but it also has to do with the mystical experience, which we'll touch on, as well as what I think of as embodiment or a knowing or sense of self deep within the body. We're going to talk a little bit about ketamine because it is the most widely available, legal, not to mention, and then MDMA because, of course, we anticipate FDA approval in 2024. So we'll start with the research, and this is going to be all, as I said, relative to end of life. So the granddaddies here, actually, Johns Hopkins and NYU published studies in 2016. Of course, there were actually several LSD studies back in the 50s and 60s with people like Stan Grof, but in the modern era of psychedelic research, then both Johns Hopkins and NYU published their research in 2016. And if you look at the two bars on the left, that is Johns Hopkins, the medium blue are reflective of the anxiety scores, and fully 83% of the participants in that study saw significant reductions in anxiety. And then on the depression is the red bars, and 78% there had significant reductions in depression. NYU, a little different, but nonetheless, 58% of the participants had significant reductions in anxiety. And this is approximately 8 months out from a single dose of psilocybin. And then on the depression scales, it was, again, 83% reduction in anxiety. Sunstone Therapies, as some of you may know, they were affiliated, well, they work as affiliated. They work with Johns Hopkins and have been the site of their research for several of their studies. And they just published one in 2023. And this was groundbreaking in the sense that they were looking at a hybrid of individual and group therapy. As you can imagine, cost remains an issue, affordability and accessibility. So they have published their results in terms of group programs and are continuing to do more along that line. But in their case, we're looking at, let's see, only depression. So the percent reduction of depression was 80% at the primary endpoint, but then also that darker blue bar reflects the depression scales 18 months out, and fully 64% of the participants still enjoyed significant reductions in depression from baseline scores. And actually 57% of the participants were in remission some 18 months out. So as I said earlier, some phenomenal results specifically to this population. Going forward, it was interesting. So Dr. Manish Agrawal is an oncologist, and he's the founder of Sunstone Therapies. And from the earlier studies, they found pushback from the FDA because it was felt that, yes, even though you're displaying these phenomenal results, it's too small of a population to garner FDA approval. So, of course, people like Roland Griffiths, like Bill Richards, like Manish Agrawal have all said, there is a clear distinction between cancer-related depression and how to treat it. Very, very, very different. So what we see happening now is that these are either studies that are ongoing. No, I don't think any of these are ongoing yet. But anyway, you can go to clinicaltrials.gov because most of them are yet to recruit or are in the recruitment phase. And you see there's a distinction here. Dana-Farber in Boston, along with the Care Dimensions Hospice Agency, is looking at demoralization, not necessarily anxiety or depression. It's felt that demoralization is more key to what we're looking at in terms of cancer patients or those with terminal diagnoses. UCLA and UCSF are teaming up to also look at demoralization. Interesting to me is that they are using ketamine as an active control. And I've been trying to figure out or ask people as to what that dosage level is, but I haven't been able to find that out yet. But I'm really curious to see what that's going to look like. I talked with one of the researchers who couldn't remember the dosage, but what they were thinking about was that since ketamine is fast acting but short lasting, that it would not have the same sort of results at the primary endpoints as psilocybin would have. Science is a privately held company. It is a startup that will also be conducting studies on demoralization using a synthetic form of a naturally derived synthetic form of psilocybin. University of Colorado is teaming up with NYU to look at existential distress. And then University of Washington, I just saw the announcement this week that they'll be doing studies on anxiety. So they will be looking at anxiety. They're more, this is kind of looking at the safety profile first. So this is, I don't know if it's a phase 1 trial, but it's an early on trial, and we'd expect Washington to continue to progress and look in terms of further trials. Ketamine. I know for some people, ketamine is something they don't like to talk about, or it's a sort of an ugly stepsister to psilocybin. But when I first started, I also was just looking at psilocybin, but I have a good friend here in Sarasota who was diagnosed with stage 4 brain cancer 5 years ago. And I met her 4 years ago and found out that she turned to ketamine because her depression was so debilitating, she basically never left her home. And she found through this is ketamine infusion therapy. She found that after the first infusion, her mood started to lift. And by the time she went through what we call the first 6 loading doses of ketamine infusion therapy, she actually felt joy. She went out and got a job, as she holds to this day, even though as her disease progressed and for some other reasons, radiation blowing a hole in her mouth, she goes back for ketamine therapy for pain. She suffers from neuropathy now and trigeminal neuralgia. And so ketamine in higher doses now has helped with that chronic pain. But nonetheless, when I started to look at research, I found there's a lot more research than what we're going to be able to talk about today. But they have looked at ketamine therapy in terms of hospice and palliative care patients. And you can see sort of the bars on your left there that show the significance of a significant reduction in depression of, I think that's like 72%, and then 48% in remission. And then the numbers on the right-hand side, the asterisks denoting that there were significant results, both in terms of mean scores on the anxiety and on the depression scales. So I also wanted just to mention at-home ketamine. This one isn't, these aren't related to end of life, but because I think it's going to be important that we bring treatments to people who may not be able to get to clinics or to facilities, that looking at home options is really viable. Of course, it would be great when we get to do this with psilocybin legally, but in any case, ketamine is here now. And like I said, these aren't relative to end of life, but two studies, showed some pretty good efficacy. We've got 70% there of the two left bars there, the blue and the red, that's on depression scores coming out of what was my ketamine home. So 70% reduction in depression with 30, I think that's 32% in remission. And similarly on the anxiety side, 68% significant reduction in anxiety with about 33% in remission. And then the Mind Bloom study, and I'm not quite a fan of Mind Bloom, sorry if anybody works for them, but this study showing 63% showed improvement, showed statistical significant improvement. I believe that. I never believed their marketing hype that you'll see on Facebook, but anyway, I think that's a solid number. So, and ketamine continues to be studied in palliative care. And I just wanted to mention a few of these because Parkinson's is huge. And so there's a company, PharmaTher, who's looking at Parkinson's patients to reduce dyskinesia for patients who use levodopa. Okay, dyskinesia is that halting movements that you see in patients with Parkinson's. And so they're looking at that. I think I'm trying to remember where they are exactly in their phase 2 trial. Anyway, if you're interested, please do Google them. Similarly, Yale University got a nice $2 million grant from the Michael J. Fox Foundation, and they will be looking at depression in Parkinson's patients using ketamine. There was this one interesting in vitro study that I thought, oh, this is pretty cool. So at least in vitro, ketamine demonstrate reducing cellular senescence. And if you don't know what senescence is, that's basically deterioration at the cellular level, which causes aging, which causes death. So that would be pretty cool if they could basically, and they're not going to reverse it potentially, but slow it down. And then one of the things, this has been studied quite a bit, is ketamine has demonstrated a reduced need for opioids post-surgery in palliative care patients, several studies along this way. And that's one of the things that's really important about ketamine that I alluded to with my friend Patty. When she started to suffer from chronic pain, especially the neuropathy, ketamine has really been able to help her manage that pain. MDMA. So there was one study with MDMA sponsored by MAPS. One of the research facilities was UCSF. And you notice here, there are no asterisks. So basically, there were no statistical significant reductions between groups. However, you do see the bars going downward. So yes, there were reductions, and they were only looking at anxiety in this case. However, Sunstone Therapies is continuing a study, a dyad study, where one of the dyads has cancer. And so sometimes it's a spouse, sometimes it's an adult child is participating, both getting 3 MDMA sessions with pre and post psychotherapy sessions. And so that study is not yet published. But there was this great article by this gentleman, Kurt Niemes, in HuffPost, I think is where I read it. So you can see what he says here. There was 2 things. I realized that MDMA allowed him to rewrite the script of a major traumatic life experience. Death suddenly loses its sting. And if you can Google the article, it's really great to explain from a person's story in terms of what he went through, how MDMA helped him, how difficult it was. It was not an easy process. And I think you get a really good feel for how an MDMA session actually goes. But of course, he also attributes MDMA to helping him with his relationship with his wife. And it would be great if she could write an article. I'd love to get her opinion on this. But you see that it takes work, right? Well, I think it takes work, although he calls it doesn't seem like work, but it definitely requires attention. So that is a study to be on the lookout for when it does get published. Now let's switch gears and talk about the importance of the mystical experience, because I think it does play a critical component for helping people, especially those with terminal diagnoses. We know that from the research that almost 70% of the people, when surveyed by Johns Hopkins, said it was in the top 5 experiences of their life. And that was, up there with getting married, with having children. And we also know that the mystical experience has been correlated to the therapeutic benefit. But I liked Dr. Byock. Some of you may know him. He's a palliative care physician. He also said it antidepressants. They are an experiential therapy, bringing the person into relationship with their own mortality. So the quality that becomes therapeutic is that memory, that sort of knowing. And this is what I also think of as the embodiment, and you're going to hear that in a second. That is the anxiolytic. So it's the memory of that knowing that happens during the session that really is what's helpful to people going forward. Then Brian Marescu also wrote this phenomenal book, The Immortality Key. And what he had to say was, not only do you die before you die, but you also gain a new perspective on life. The ego death that occurs during the ritual changes your orientation about existence. And Bill Richards, key researcher out of Johns Hopkins, was famous for saying, I hope you die today, meaning as they go into their psilocybin session, I hope you experience an ego death. And we're here to help you. All right, so in their own words, I want to share 3 short video clips because these people really do say it all. Oh, can you hear that?
No.
I tell myself, I even make a big note to please turn the sound on, and then I go and I forget it again. All right, sorry about that.
I mean, I feel like death doesn't.
It was certainly freeing for Carrie Pappas, though her cancer has now spread to her brain. Her crippling anxiety about death is gone.
Yeah, it's amazing. I mean, I feel like death doesn't.
The most meaningful experiences of their lives. For some, it was on par with the birth of their children.
To this day, it evolves in me.
It's still alive in you.
It's still absolutely alive in me.
Does it make you happier?
Yeah, and I don't necessarily use the word happy. Comfortable. Like comfortable. I mean, I've suffered from anxiety my whole life. I'm comfortable. That to me, okay, I can die. I'm comfortable. I mean, it's huge. It's huge.
I also felt a tremendous connection to everyone I've ever met and known in my life.
It was such an epiphany for me. The cancer and the friends and the family and the past relationships and the present relationships, they're all together. you know, and they're all connected. I felt that I was bathed in love.
I was feeling pure love.
And I felt so beautiful. I felt like I have never felt before. My sense of being loved, of being worthy of love, of being cared for, of being important to someone. It's huge.
That was a patient suffering from kidney cancer giving emotional testimony to the healing powers of psychedelic mushrooms. She was part of a groundbreaking work that's happening at one of the country's oldest and most respected institutions, Johns Hopkins University.
All right, I absolutely love those clips. And the thing, well, they all said something similar, but with Carrie saying it's alive in me, that to me is the embodiment. That's where you can feel, you have this knowing, it's a felt sense that you can carry forward and resource anytime you want. And for any of you, and I'm sure many of you have experienced this, I surely did, most notably with ketamine, where I got to a point where I just felt like I was, I don't know if any of you know the 3 layers of life from Ayurveda, with the physical, the personal soul, and the collective soul. Well, I embodied that one time in a journey, and I can resource that as needed, which is sometimes does come up. So, you know, I just think that's beautiful. And so those 3 things, the neuroplasticity, neuroscience, the mystical experience, and the ability to embody that felt sense is really what makes psychedelics work especially well for people with terminal diagnoses. But let's get into the health considerations. And by the way, as we all know, it's not always like that. Journeys are not always like that. People have to go through some tough stuff. So even though Bill Richards might have said, yes, I hope you die today, you know, that is not an easy thing to do. And for any of you who've sat with individuals, you surely know that. So we can't make light of it. We can't, well, we have to pay attention to it. And we're going to talk just a little bit about the health considerations, which basically fall in line with everything that we know for not just people with life-threatening illnesses, but anyone. So we know, though, in general, from all the research, that these medicines have a high safety profile and a low risk of adverse effects lasting more than 24 to 48 hours. Oh, I'm going to get on the soapbox for just a second. All right, so for that University of Washington study, the article I read was a little disconcerting because it talked about treatment adverse events, including the feeling of ego death and dissolution or hallucinations. And I'm thinking, oh, no, that's not a treatment adverse event, you know, but it's really there to help you heal. But in any case, hopefully we can also get beyond that. But nonetheless, high safety profile in these medicines. Ketamine is on the World Health Organization's list of essential medicines. As I've already said, it's also proven efficacious in relieving chronic pain and decreasing the need for opioids. In general, there's support for psychedelic therapy for anyone suffering from existential psychological distress when other treatments have failed. And we know, goodness, that treatments have failed. Contraindications, and these are pretty much the same for anyone. We know uncontrolled hypertension or severe heart disease. Psychedelic therapy deferred when patient is in active cancer treatment, but I know people who are looking at that, and they look at it as on a case-by-case basis, so it's not always deferred during radiation or chemotherapy. Just depends on the circumstance. We also know contraindications: schizophrenia, bipolar, manic phase, borderline personality disorder, although I just love the fact that people are pushing back on that and have begun to look at that seriously as well. Ketamine, now ketamine is a different beast than psilocybin or MDMA. people with severe liver or bladder disorders or intracranial pressure should really stay away from that. Ketamine is known to cause cystitis and severe bladder distress in some patients who use this on a continual basis, especially those who use it for chronic pain. So that necessarily, I mean, that seriously has to be looked at. But nonetheless, what's important here is, of course, is for any population, especially for this population, to have proper screening and assessment. And if we looked at some of the drug interactions, again, similar across the board for anyone, but obviously there may be other drug interactions for people with heart disease or people with life-threatening illnesses. But we know that for psilocybin, SSRIs can blunt the effects and benzos can stop the trip. Lithium, significantly higher risk for seizures. But on the flip side, for ketamine, some of you may not know that both lithium and SSRIs can actually enhance the effectiveness of it. St. John's worts, because it operates on the liver enzymes, can reduce the effectiveness, and benzos also reduce effectiveness, although not necessarily sufficiently enough to stop you from using ketamine. Ketamine also, one other drug, antidepressant or mood stabilizer, is Lamictal or lamotrigine, that also blunts the effectiveness of ketamine. But I can speak from personal experience that I just needed a higher dose of ketamine, and it was totally worth it. MDMA, again, a little bit different than the other psychedelics. SSRIs can greatly reduce the effectiveness, and they have a higher risk for serotonin toxicity, unlike the other ones cited. So preparation and integration. For all of you here, I'm definitely not going to go into preparation and integration because I know you know what that means, but I will speak to it just specific to what I think is important for people with terminal diagnoses. And I feel strongly that for this population, expanding a care team to include end-of-life doulas or hospice chaplains and ministers, hospice volunteers is really critical. I can't think of a better person, no disrespect to any psychotherapist, but I can't think of a better person than an end-of-life doula or a hospice chaplain to sit with somebody during a psychedelic journey. These folks are practically transcendent in their ability to hold space for anything, right? As people transition from this world into the next place. I think then along with that, I don't want to see integration sessions. All right, we have 4 integration sessions or we have 6 integration sessions. This is where an end-of-life doula or hospice chaplain can play an important role as well to help a client continue to integrate, obviously for as long as that person is needed. I have a preference for this community. It's especially to do this in person, in community, to be able to talk with people who have the same issues, who have the same fears, I think is really critical. Obviously, if they're not able to participate in person, to do this online, and again, for as long as needed. In the home setting, and what I mean by that is to be able to take advantage of the medicines in the home as opposed to needing to come into a facility. We know that that's not always possible, but I think it would be really important to be able to factor that in as an option. And then really critical, I think, is to include families and friends. When I started to do some work for that psilocybin retreat in Jamaica, we built a program to include families. And I think that that's really critical, to not just undergo the psilocybin sessions or ketamine sessions in a group, but also to be able to talk about the fear of dying, to talk about your relationships and what comes up during that. So I'm going to come back to that in just a little bit, because I'll spend just a few minutes talking about my nonprofit. So I have 3 major programs. One is to educate, and that includes both on the consumer side. So anybody with a terminal illness, and as like I said, their families, non-licensed and licensed professionals, so to provide very specific courses on psychedelics as it relates to end of life, and then to build a membership directory. And this will be an active membership directory where we'll match clients with professionals I know that are experienced in both end-of-life issues and psychedelic care. And then to develop what I'm calling a holistic care delivery model, and to be able to take that to various service providers to offer a customized psychedelic assisted program. So if I look at education, I saw Michael Fratkin come on. Hey, Michael. So Dr. Michael Fratkin is going to facilitate an open forum on psychedelics on August 28th. This is for consumers only. We want to be able to gather and hear their questions as it relates to psychedelics. So I'm really excited about that. As I alluded to up front, the next free webinar for anybody, a consumer or professional or anybody in between, is an intro to psychedelic care for end-of-life issues. That's going to be September 12th. And if you are a professional, I would encourage you to bring a client or two along for that. And we really will delve a whole lot more into the benefits and the pros and cons of psychedelics, the three that I've talked about today, and the neuroscience. We'll be doing a mindfulness and psychedelics course before the year's out. I just haven't had that scheduled yet. And then we'll be running a series of preparation and integration discussion groups as well, starting in 2024. We're just wrapping up our first end-of-life doula training program tonight. It's a 4-week program, 8 modules. So our next one is going to be starting on November 28th, facilitated by Catherine Durkin Robinson, who is an educator, end-of-life doula, and a psychedelic journey companion, as she likes to call herself. This is a traditional end-of-life doula training program, but you will learn about emotional support, communications, grief support, legacy planning, advanced care directives, and she conducts it in a really great combination of online lecture, case studies, experimental exercises, and group discussions. And I will say one of the big reasons why I formed a nonprofit was to keep all courses like this low cost. So this is typically $600. I offered it for $550 for our first go round. So we'll see what happens come November, but chances are it'll be $550, which is quite a deal. Then starting next month, I am so jazzed to have our psychedelic core course program with the folks that you see here. First of all, there's psilocybin for end-of-life issues, ketamine for end-of-life, screening and assessment, preparation, the journey and integration, and then ethical and legal considerations. Both, as she likes to be called, Grateful Deb and Christina Ingenito, if you know them, they have been holding ceremonies for people with cancer and terminal diagnosis for about 40 years apiece. So these women have been doing this for a very, very long time. Dr. Michelle Weiner out of the Miami area does not specialize necessarily in end-of-life patients, but she does a lot of work with people with terminal diagnoses, both on the chronic pain as well as mental health side of ketamine. And then many of you would know Ben Malcolm, our beloved spirit pharmacist. So he'll be doing the screening and assessment. And then many of you would also know Catherine Tucker, spearheading the lawsuit on behalf of Ames Institute out of Washington with the DEA. So really cool, excited about that. 6 courses, only $270. So yeah, hit me up if you're interested in that. Coming soon will be the membership directory. Finally got a chance to kick off the development of that. So I'm hoping that will be ready by the end of next month. And then this I'm also very excited about. And Matt Whistler, if you're still on, I would love to talk with you at some point. So I'm looking at building what I call these holistic care models for a lot of different types of service providers. So ketamine companies, one of them an at-home ketamine company where I'd like to run a pilot in the state of Florida to bring end-of-life doulas into their care protocol to be with the client during the ketamine sessions. In Oregon, I've started to talk with a licensed service center, and as yet not approved licensed service center interested in end-of-life to bring a program specific to people with terminal diagnoses and their families. And then to look at psychedelic retreats. Also, well, the one in psilocybin is still available, but what I quickly learned was that we need to bring the psychedelic to where the individual is. So I'm also talking to people in Oregon about bringing a retreat program there and working in conjunction and with within the regulatory framework of a licensed service center, because as we know, we have to use the facilitator's license through the state and working for that specific service center. So that's basically what I'm all about. And if you'd like to reach out to me, please do. There's my email, there's my website. You can go to that website to register for any of the courses.
Right. Well, thank you, everyone. Unless you got, any other questions, I'll end the recording. And if anybody would like to stay on and chat, with any of us, we'd be more than happy to. Otherwise, you got our contact information.